Hey future doctors, today we are going to see about intro and history of microbiology. So we will be seeing it in detail. First is Anton van Leeuwenhoek. He was the first scientist who observed bacteria and other microorganisms. He used a single lens microscope, so he named small organisms as little animalcules. Then second is Louis Pasteur. He is known as the father of microbiology. He proposed some principles such as principle of fermentation. Then he also proposed sterilization techniques, then pasteurization of milk, as well as germ theory of disease and liquid media concept. These all things are proposed by Louis Pasteur. The next is Edward Jenner. He was the first scientist who developed first vaccine of the world, that is for the smallpox. He used the cowpox virus, that is known as variola vaccine, to immunize children against the smallpox. The next scientist is Joseph Lister. He is known as the father of antiseptic surgery. He observed that the post-operative infections were greatly reduced by using disinfectants such as diluted carbonic acid during surgery to sterilize the instrument and clean the wound. The next is Robert Koch. He introduced solid media for the culture of bacteria and use of agar as the solidifying agent. As well as he also introduced methods for isolation of the bacteria in the pure culture. He also described hanging drop method for the testing motility. Discovered bacteria such as cholera bacilli, as well as staining techniques by using the aniline dye. He also proposed phenomena and postulates. So first we will see about Koch phenomena. He observed that the guinea pig already infected with the tubercle bacillus and developed a hypersensitivity reaction, and when injected with the tubercle bacilli or its protein, since then this observation called as the Koch phenomena. So here Koch observed that the pig was infected with the tubercle bacillus and pig developed a hypersensitivity reaction, and since then this observation is known as Koch phenomena. So additional to the Koch phenomena, we will see now postulates of the Koch. So according to Koch, microorganism can be accepted as the causative agent of an infectious disease only if 4 criteria are fulfilled. And what are these 4 criteria? We will just see. First is microorganism should be constantly associated with the lesions of the disease. Then it should be possible to isolate the organism in the pure culture from the lesions of the disease. Then the same disease must result when the isolated microorganism is inoculated into the suitable laboratory animal. Then it should be possible to re-isolate the organism in the pure culture from lesions produced in the experimental animals. And antibody to the causative organism should be demonstrated in the patient's serum. So these are some postulates of Koch. So we will see exception of this. First is Mycobacterium leprae and Treponema pallidum. They cannot be grown in vitro, however they can be maintained in experimental animals. So second is Neisseria gonorrhea. There is no animal model, however it can be grown in virus. The next scientist is Paul Ehrlich. He is known as the father of chemotherapy. His contributions are, it is first to report the acid-fast nature of the tubercle bacillus. He also proposed a toxin-antitoxin interaction which is called as Ehrlich phenomena. Paul also proposed the side chain theory for antibody production, as well as he also contributed in the chemotherapy discovery, that is salvarsan, which is used for the treatment of syphilis. Next scientist is Hans Christian Gram. He developed the method of staining called as the Gram stain to make the bacteria more visible and differential under the microscope. Then second is Ernest Ruska. He is known as the founder of electron microscope. Then next is Fleming, Alexander Fleming. He discovered the antibiotic penicillin. The next scientist is Louis Pasteur. He described viral culture technique in the chick embryo. The next scientist is Barbera. He described the mobile genetic elements in the bacteria which is called as transposons. The next scientist is Walter and Frederick. They actually developed the method of the DNA sequencing. And again one scientist, that is known as Kary Mullis. He discovered PCR. So this was all about the history and the intro of the microbiology.